Welcome, everybody, to the Breathing Lab by Dr. Jenny. I have Dr. Catherine Murphy with me. Catherine I'm very lucky because Catherine is near me in Chicago. She's in Indiana, and we are neighbors, and we've done a lot of work together, collaborating together around learning. We did a book club for a while, and she's seen my kids. We'll talk about that a little bit later. But she's great. She's an orthodontist, which is amazing in this field of airway. But she's also a holistic health advocate by passion. She's authored 2 picture books. One's called Dear Mama, and the other one's called Dear Friend, Do You Know About Tongue Ties? She likes to empower families to recognize the deeper connections between symptoms like poor breathing, sleeping, or eating, and their root causes. Her personal and professional experiences have led her to unlearn conventional approaches to favor of a more compassionate and collaborative model of care, committed to providing life-enhancing treatments rather than short-term solutions. Dr. Murphy strives to bring health, hope, and harmony to every family and audience she serves. So I am just so thrilled to have her here with us. And just a couple of pictures. So this is us at the AAPMD. This conference is amazing. If I know there's a lot of healthcare professionals here. This is a very all-inclusive, collaborative group, from MDs to dentists to orthodontists to myofunctional therapists, PTs, SLPs, OTs, you name it. It's like the whole group of medical providers that deal with airways, and everybody has an airway. So every patient is represented by this group. So I really urge everybody to consider going to that. This is so every Collaboration Cures conference has a fun evening. And so Catherine and I had a lot of fun that night. This is also she's a great dancer, by the way. This is also Sandra Khan is there. That's us dancing. And also, my mentor, Mariana Roccabato, did a pre-conference there. So it's just a great place to learn. We also collaborated and did a course, a lecture together on airway and how I've brought airway into his head and neck treatments. So I'm going to stop share here. And this is great. I'm so glad that we finally found time to do this.
Me too. Thank you so much for welcoming me into your community. And I'm so thrilled to be able to share with all the people that you have attracted, because you attract wonderful people.
Oh, thank you. Thank you. I have a list of questions, but I'm not going to look at them quite yet. So I am starting the timer. The timer's on. Anybody have questions, just put it in the chat. So listen, we've known each other for a while. I've brought my kids to you. I'm a PT, you're an orthodontist, and an airway advocate, right? So I want to bring up something I think that's very important. Everybody who has kids tends to have problems with their children at some point, and maybe they know about airway issues and maybe they don't. My journey started very long time ago, and thanks to Joy Moeller and Kevin Boyd, who kind of intercepted my kids. My kids were 4 and 2 at the time, and that, who would have known? Do you think that kids are like healthy and they're young and no problems? They took it was Dr. Boyd that found her very narrow in the mouth. And then I went to see Dr. Klepacki out in Hinsdale, and he took an x-ray and he said, Jenny, the adenoids are huge. You got to go see an ENT. It was like, that was my wake-up call of like, what do you mean the adenoids? What's with my kids? There's something wrong with my kids? So, no one wants to hear that there's something wrong with their kids. And you'll get a lot of pushback. I've had a lot of family members, even my family members, that are like, what are you telling me? There's something wrong with your nephew. The tongue tie issue. And I didn't know. I didn't know anything about tongue ties. Here I am, a craniofacial PT, doing a lot of TMJ and tinnitus work and like dizzy and that type of work. But like, I didn't know about tongue tie and how that affected the way we hold our bodies and the way we breathe. So um, I forget when. So I've done a lot of expansion for the kids at a very young age.
Mhm.
And you think, oh, good, then I'm done,
Yes.
right? And no, you're not done, by the
No.
way. There's so many factors there. So I
Yes.
want to just open up the conversation to
Mhm.
why do you think this is such a problem? Why do you think children, and mind you, adults too, have breathing problems? And why won't they just go away after you address them? Why do they keep coming back, or you have to keep working at it?
Well, so I'm going to answer it in two different ways, because for those that haven't heard me talk at first, the first answer is going to be the answer for those that are very new to this. These are all going to be adults who are listening to this. I just want you to remember when you went on vacation and you were staying in a hotel and the pillows were not the kind of pillows that you liked, and it was loud, you didn't quite get a good night's sleep, and then you had to perform well for work the next day. How easy was that for you, or how hard was that for you? And imagine that that happens every single day. And you don't know anything better because all you've ever known is trying to go to sleep in that really horrible hotel room. And I say that because most of us can relate to that really bad hotel room experience where you're like, your neck is tight, and all day you're trying to like, oh, I really just want a good night's rest, but you have to go back to that same hotel room. And if we understand that that is what some kids start life with, they start their life being uncomfortable, and that's all that they know. And that many of us have gotten to be understanding that you are supposed to live in some discomfort. There's this magical age of like, what have I heard? Oh, once you hit 25, this happens. Once you hit 30, this happens. And then 35, and then boom, 40s. And then don't even talk about 50s, 60s, 70s. It's like as if
Right.
we're supposed to, not feel good every day. And that's why when I was writing the dedication for the book, Dear Friend, I realized, oh gosh, this was supposed to be a compilation of all of my patients, right? And kind of my son, even though my son at that time wasn't that age and going through that experience just yet. But I realized that that was actually me. And I realized that I didn't know as a kid. I didn't even know until I was about 38 years old that I could wake up feeling good. Right. So some of the problems is that we don't know that our bodies are actually supposed to feel good, that we are meant to be healthy. We're not meant to have a bag of tricks next to us all the time, whether that be your ibuprofen, whatever, your tea every single day. So why is it? Because I think we have not gotten really in tune to how to make us feel good and to honor that, because it seems too easy. Oh, so I just have to breathe, but I already do that. None of us would be here if we weren't breathing, but we could breathe incorrectly. We can just do survival breathing, which then will make us not feel the way that we're supposed to feel every day. It's going to make us feel like that bad hotel room. So then if I've gotten you and you haven't heard me before, stick with me, because I'm going to take it to that next level. Because if we're not feeling good and we don't know and we don't trust our bodies that we're supposed to feel good, our nervous system is off. And if we have a dysregulated nervous system, we can't expect any one provider to be the only help that we get, right? But so many of us expect, okay, I'm going to go see Dr. Jenny for this, and she's going to cure everything that has to do with that problem. Except the body isn't like your car. You can't go and just, oh, we're only going to focus at your tires. We're not going to look at anything else. Well, you wouldn't want a person that's fixing your car to only look at your tires and ignore if you don't have any oil in your engine, right? So how can we expect our body? Like, okay, I only have pain in this shoulder. Why are you asking me about any other part of my body? But we've gotten kind of trained to do that. And if our nervous system is dysregulated, everything is off. So why are we so off? Why are we so unhealthy? Is because we are doing more survival breathing And there's so many things that are going into that affect our nervous system that makes us not feel good. And like I said, many of our kids, they start from birth not knowing that they can feel good. So was that an answer? Was that just me going around in circles?
Well, no, I think you're right. I mean, there's so many factors that are so hard to deal with. And you know what? As a very busy mother with 3 practices and a husband that needs attention and a dog that needs it, like, it's like, where does the time go? I'm a very busy person. I made the time for my children and their health and their breathing, but I get a lot of patients or parents that bring children to see me, and they kind of want you to fix their child, right? And they're like, well, myofunctional therapy didn't work. And I'm like, well, how much were you engaged in their care? And, at 6 years old, do you think they're going to remember to do their exercises or whatever? I'm very, very strict now with the parents that I take on as patients. I'm like, listen, if I'm going to take care of your child, I'm your coach. You're the trainer. You're with the child the majority of the time. I'm not going to be able to miraculously change them. You are the ones that really will make a difference here. But I find that parents are too busy and they're overwhelmed. And so dealing with that, and really sugar is a big problem. I see parents bring treats to the appointments, and they're like, well, if you do this, you just do that, I'll give you this. And I'm like, oh my gosh, what sugar does, what diet does, what the processed foods, that's the whole like a big part of the problem.
Yes.
Is food and what these kids are eating and the inflammation it causes in their noses, in their digestive system, in their gut. So it's like a bigger problem because of that. And it's parents, are very much overwhelmed, and they have this pattern of everything's easy and accessible in snacks that are packaged. All those things are not good for you. So tell me how you feel about food, and how do you guide parents around the diet?
Well, with everything, I try to really focus that this is a lifestyle change. If you want the holistic approach, the airway focused approach, the collaborative approach, it is viewing your whole lifestyle of your entire family. And your family, that's going to support, it's going to be anyone that has a really heavy influence on yourself and your child, right? Because you can't go and see Dr. Jenny and be like, okay, I'm going to be on time for my appointment, but then not do the follow-up care, right? Because like you said, you're only with them for so long. And we need to approach our health in a different mindset. And instead of handing over the responsibility of our health to a healthcare provider, we need the parents to look at us, like you said, as being the coach. Like, I am going to coach you and support you for your health goals. But ultimately, and this is why it's so tough on some parents, is that we are each responsible for our own health, and we should be seeing our providers to support that. So when you first started, and how parents don't want to ever hear that something's wrong with their kids, we get to change that and really get the parents to tell us what is actually, I hate to say this word, but it's really the truth. Okay, what is really frustrating you about your kids? And most of that was all going to go back to that dysregulated nervous system from the poor breathing. And that child trying to compensate, and the parents honestly trying to compensate for that child's dysregulated nervous system, their mouth breathing, by giving them that candy. Because the reason why they like that candy so much is because it gives them that instant burst
Burst
of energy, right? Because truly, once you are really in your body, a lot of those sugars, your body knows. Your body knows what is going to actually help it and what's going to hurt it. And I'm not one to say, I will still, and I tell everyone this, I will still eat one bag of Cheetos over the whole Doritos thing once a year, because for a time I loved them because I needed that quick burst of satisfaction because
Mhm.
I was struggling. I didn't realize how much I struggled because that's all I knew. And especially how I fell into the category when I went in for my list of symptoms. I was a relatively thin female. So they're like, oh, well, you have IBS. Well, you have anxiety. Okay. Or we can go back and it was really just a poor diet and poor sleeping and poor gut health and narrow arch of 28 millimeters. And my
Oh
max
my
is a little
goodness.
bit far back. So
Yep.
let's go back to all of that. And from my perspective, basically, if somebody has crowding, which over 90% of the population in industrialized countries now does, right? There is a systemic problem. And the mouth is the mirror of the overall health. So if we can see what's going on here, and sometimes it's very simple. If they have bad breath, if you can smell someone that has bad breath, it's very simply there's something going on with the gut. We can blame it on oral hygiene, and that's going to play a role, but the gut and the mouth. So if there's already something out with the gut's also telling us about serotonin. It's helping regulate that nervous system, right? So the mouth is the mirror of the overall health. And for those that aren't in dentistry, that's a very easy thing. If someone's coming around and you're like, oh man, that I really like working with that
Yep.
person, except I'm gonna put my mask on.
Oh, it's funny. I'm a part of a group called the Airway Mouth Doctors. They make all their patients do a fit test, and it's a food allergy sensitivity test, and it's blood. You drop 5 little blood drops into this test, and I've always had like IBS and I was a mouth breather, bicuspid extraction case, jaw setback. I've done a little expansion. At some point, I might do a MARPE if it continues to look like it's going the right way. But I found out I had candida and sugar feeds it. And so I'm like, I stopped in August and my life has changed. Now I want to get my kids to do it. And my daughter's like, I don't want to know. I'm like, you're going to take that test. And so it's my husband first, and now my daughter's going to be next. We're waiting for his results, but I highly recommend that it's that you figure out what you're sensitive to, because that causes inflammation in your gut and in your nose, and then you're stuck with a forward head posture and breathing in a hyperventilated way. Like so I'm. It's to me, I've just realized how impactful the diet is.
Yes.
And I don't think I was addressing it with all of my patients. Now I'm like, okay, because I'm a PT, it's a little different. But I'm like, I don't care. Everybody can take this test. You want to breathe better, you want to feel better. So another thing that I wanted to talk about is patients think they want to check it off the list that they've done expansion and they're done. As an orthodontist, you've become this more airway centric orthodontist recently. It wasn't in the beginning, right? So you saw patients and you tell them just wear this retainer and yeah. So tell me a little bit your experience around the relapse of ortho and the root cause, and even when my kids have gone to you and then now they're in their second round of expansion, and I'm trying to get them to do GoPex again and to up blocker training, which is the posterior tongue and the soft palate. I'm getting a little kickback because they're 14 and 15. Kind of sick of mommy talking to them about breathing through your nose and keeping your mouth closed when you chew and swallowing gently. It's frustrating as a parent. It's frustrating because you try and it's still not done. I'm not going to be done until they're out of my house and they're out of my sight. And then it's their problem. But tell us what you tell parents around this topic.
Well, I am actually embarrassed for my specialty because we have accepted that 92% of people that once they stop wearing their retainers will experience relapse, meaning their teeth will go back. Now, it's different varying degrees of how much things will go back. Some people, it would be minimal, so 1 millimeter. Sometimes it's tremendously more. But that's embarrassing that a 92% failure rate. I have an 8% success rate once you stop
Wow.
wearing your retainers. But I will say it's also genius in a way, because, we put it on you, the patient. Well, wear your retainers for the rest of your life. Well, how many things do we still do every single day that we did when we were 14? And that's just part of like wearing a retainer. There's all those things going on with it. But to strap that onto a patient at 14 or whatever age, I'm just saying back in traditional days, they would be done around 14 or so, for the rest of your life. So for the next 80 years, you have to wear retainers. And like that was acceptable. And so then they'd come back and they'd be like, yeah, I forgot my retainer, I threw it away, or I just hated wearing it. And they would go back for a second set, a third set. And what was interesting to me, especially because I started at age 15 as an orthodontic assistant for my father, is that how people would perceive it. And like different people would be just really shameful of not wearing them. Some would be mad. But for most people, people were just complacent, like, yeah, my teeth will move back. And it's like, well, we just really need to shift that a little bit and start asking why. Why in the world would only 8% of people not have to wear them for the rest of their life to keep their teeth straight? And things change, our bodies change, okay? But it shouldn't be to the point where if you got a procedure done, that then you should have to go through it 3 more times if you've addressed the root cause. But we're just not addressing the root cause, right? And that's with the specialty, but also what the patients are asking for. So the thing is with orthodontics, addressing the root cause does actually take different times, right? We can address certain things as young as it's first noticed. Okay. So that's when the AAO, the American Association of Orthodontists, actually states that the child should see an orthodontist at the first sign of a bad bite or by age 7. So the age 7 part can be way too old for some and might be too young for others, right? But whenever you first see the bad bite is when they should be seen by an orthodontist and first addressed. We need to understand that this is growth and development, and this isn't fixing and done, okay? So we should look at why the one time and done has a 92% failure rate and change that. And that's why when it's early orthodontics, I really like to have the whole terminology changed. It's growth and development. It is orthopedics. It is whatever you'd like to call it, whatever works, so that you're not thinking braces, because then people think, oh, we're just aligning teeth and I want to be done. This is changing the growth so that we can have the growth pattern more forward, so that we can allow more room for that tongue to come up, so we can allow more room for the teeth to come through. It's not the teeth, it's the jaws. It's the growth and development, but then you need to maintain it. So what I recommend to every patient is myofunctional therapy. I say there's 3 main systems of the body that have to be addressed when you're going through orthodontic treatment. The skeletal system, which is what I'm in charge of. I'm going to help those jaws widen. But then you have the muscular system and the nervous system. The muscular system, myofunctional therapy, but you might need others. You might need other support for the muscular system. The nervous system, that's going to be the one that is really the most versatile for the patient, because sometimes it's just PT, chiropractic care, cranial sacral therapy, but others, it could be all of them. It could be OT with that. They might need more support, and then that support needs to be continued. You don't get to just go through and, okay, I'm gonna do my exercises that Dr. Jenny tells me, and then I'm gonna be done once I'm done with her. This is something, it needs to be incorporated into your lifestyle. It's a lifestyle change. It's viewing your health, that you are in charge of your health. So yeah, you might need an expander at 4, then they'll continue to grow. Then you're going to evaluate that growth. You're going to see if they've been able to maintain. You're going to need to look at all the other things that affect that child's sleeping and breathing, and then look at if they need another expander. You're going to look to see if they need protraction, because a lot of times, depending on the age, they might not be able to wear the protraction face mask early on, even though that's the best time. But we have lots of sensory issues. And if you can only get in there and expand at first, you do what you can for that patient at that age and what support. And then you're going to be needing the AP needs to be looked at, but sometimes, like patients I work with, they need that support to go through and have something that's on their face. We don't think about, did you want to ask, do you want me to
Yeah,
explain that
no,
more?
I wanted to mention my
Mhm.
son was very class 3, where his jaw is set forward, his lower jaw. And we've been working with Dr. Iwei Wang, great
Mhm.
orthodontist in Chicago, but he was getting skin issues. And I said, you know what, there's got to be a better way. There's something called the crane that helped him. He
Oh,
was
that's wonderful.
compliant. It's around the neck with
Okay.
the thing sticking out, and it
Mhm.
pulls this way, but the neck is a lot stronger than the face.
Mhm.
So I highly recommend the crane as a
Wonderful.
protracted device. And it took 4 months instead of 8. And
Oh, that's
it was
excellent.
just because of the compliance. And
Mhm.
he didn't wear it like he was supposed to wear it right after school and all that, but he wore it every night. But
Oh, that's excellent.
you mentioned it's like a lifestyle change. Like my PT is like all inclusive. I'm trying to get patients to understand the body and how your body is supposed to be shaped.
Mhm.
The skeleton, we're the musculoskeletal experts from understanding how the joints in the whole body move and how the spine and the curves of the spine need to be maintained. People aren't aware of their posture when they're sitting and how we start to
Mhm.
lose that stacked up alignment. And what happens in your throat when your head goes forward, your tongue starts to lose that support in the throat, and then your neck is in that posterior rotated position, causing all kinds of tension and strain to the body. So
Mhm.
I get people to readjust throughout the day until they start living in that new position.
Yes.
But it wasn't really until the throat part, and what I use is the up blocker. It's a little apparatus that creates suction that allows
Oh,
you to support the throat.
oh, excellent.
That's the timer.
Already?
Support the throat. I know it goes like that, right? But what I want people is to chew softly with their teeth together, and their chew on both sides and create a bolus and swallow gently and breathe through their nose. And if they do all those things, they stay back here.
Mhm.
When their mouth drops open, and like I get them better, and then they stop doing their exercises, and then they come back later, and I'm like, okay, so the concepts of changing lifestyle, changing the patterns of how you use your body, how you breathe, how you swallow, how you chew, how you sit, how you pick up things, all of it's so important to nudge the body in the right direction. And as a mother, talking to all the parents that are on this call or whoever ends up watching this podcast, be patient and know that you're doing the right thing. Spending money on creating space, expanding, and working on the breathing and the functional part of life. This is such a vital part of our health that you need to um, not not give up, and know that people end up causing issues with sleep and eventually sleep apnea, snoring, all those things happen to these little ones that we try to help in the beginning, and we can. But be
Mhm.
patient, work on your diet, keep working on your oral posture and your chewing and swallowing and breathing. So
And
um
small changes. It doesn't have to be all at once. It just really accepting that you have more control of your health than any provider will ever have, because you're the one who decides what to put into your body, on your skin, every day. So start with one thing. If I could, I would ask every single person right now. Do I have like 2 minutes of like my top
yeah,
things? Do you
yeah,
want
I
top
always
things?
ask people, tell me what's what would you do to be the healthiest you?
Oh, so the easiest things that won't cost you money. Okay. Go around your house right now. If you have anything, I'm sorry to name drop, but Bath and Body Works or Bath and Body Works type stuff, put that away. Just unplug, unplug whatever fresheners might be in your outlets, unless it's an essential oil, but I don't think they really do those into the outlets. Those Glade plugins, those are going to really just agitate your breathing, okay? Along with a whole other cascade of things, but we're focused on breathing. That doesn't have to cost you anything. You already bought it, put it to the side, okay? See how you feel a week later by not using it. The next time you buy detergent, look for a detergent. Just start looking for a detergent that doesn't have a bunch of smell to it. Just start with that, okay? Just right now, just start. You can still go to the same place. I don't get mine at the same place anymore, but look for one without all the smells, okay? Because your skin is the largest organ. And just, again, this doesn't cost you any money. When you eat, sit down and don't have your phone, and pay attention to how you feel after you eat. The more you enjoy your food, and know that this is supposed to be an enjoyable process. You're supposed to sit down and relax and fuel your body through your food. So just sit down. We've got so many things that can take up our time, but even if it's just 5 minutes of nothing else, and you just focus on eating, you might not be done with everything, but 5 minutes, give yourself 5 minutes. And your kids too. We're at 5 minutes, we're just going to focus on how good this is to nourish our bodies. It sounds small, but it can be that tipping point where you get everyone working together and knowing like, oh shoot, I do feel a lot better. Because once you know you can feel better, you will do the things that are going to help with that. Because our motivating factors are to avoid pain or seek pleasure or fear, but we fear the unknown. So instead, like, let's seek pleasure in feeling good and knowing that you can feel good.
That is such great advice. Thank you so much. I want to end on one thing.
Mm-hmm.
These books that I'm going to put this little slide up real quick. Tell me about these books, real quick.
Oh, so Dear Mama, well, actually, both of them came out during the pandemic. I delved into my creative side, and I was so thrilled with my second child that I was able to nurse her. And a rush of emotions came of me then really working through the struggle I had with my son to nurse him, and the message of like, you're enough. Mama, you are enough is like that main message of Dear Mama, but it shares that story of that struggle of my son just couldn't eat. He couldn't eat well, he couldn't sleep well, he couldn't breathe well. And all I was told was that I was a mom that worried too much. So that was written to help support moms when they do go through something that's scary. Anything. In this case, my story was that taking my son through having a tongue tie release as a baby, it was scary. And I had a lot of people telling me that I shouldn't do it, but following my intuition, following what my baby needed, and to support moms to follow their intuition, and that it's tough to make decisions for someone that has no voice, but you know your child. So that's Dear Mama. And then Dear Friend, as I mentioned, it was supposed to be a compilation of my patients and my son, and I realized it was myself. It's to really let every child know that that child deserves to feel good every day. And it connects the dots between this child who snores, grinds their teeth, can't eat the carrots that mom puts in front of him, has a bunch of cavities and they don't know why. And then they switch dentists, and the root cause gets discussed like, hey, well, this child can't breathe. The child has a tongue tie, and the child goes through therapies, including myofunctional therapy, and now is happy and showing that support of trusting yourself and your child.
It's really things like this that help support parents that are going through such difficult situations, and having the resources to help. And more people like you and I need to spread the word, because it's still not common knowledge. All of this stuff is like not at all. I teach Airway, an intro to Airway and evaluation treatment, and then all of the PTs in the classes, everybody knows someone that has a problem, right? Everybody. So I'm on this mission to really help educate, and I appreciate all the time that you put into all of those those beautiful books, all the things that you do with advocating for other dentists to learn this stuff. It needs to be common knowledge, and we have a lot of work to do. So thank you, Catherine. Thank you for taking the time. I really appreciate it. And we'll see you at the next webinar. And I'd like to have you back at some point in the future. Okay.
Thank you, Jenny. Thank you for all that you do.
All right. Thank you. Thank you, everybody, for listening. And we'll see you in 2025 with our next new set of podcasts. Thanks for your listening. Take care. Bye-bye, everybody. Thank you for listening to the Breathing Lab with Dr. Jenny.